Few things related to Mutra kshaya. The disclaimer is this is not for non-medical people. This is for the knowledge of the clinical persons in Ayurveda only, and this is not a complete theory class for student. This is the purpose of this discussion is to make the internees, PG scholars, practitioners to start thinking in Ayurvedic clinical practice. This is a motivation. This is also an encouragement to think or how to plan about a clinical condition. Now, today we are talking about Mutra kshaya. Mutra kshaya is a Mutra Vikara. Kshaya is related to quality and quantity. So, Mutra Nirmana Karmahani or Mutra Pramana Kshaya or Mutra Pravrutti Vikaram. There are three components of Mutra Kshaya. One is Mutra Nirmana Karma and is Mutra Pramana, a normal Pramana of Mutra quantity, and Mutra Pravrutti. Mutra Pravrutti is due to Vyanapana Dosha. Mutra Nirmana takes place in Pakvashaya. Mutra Nirmana is supported by Pranavata, Samanavata, Udanavata, and Apanavata, Nidanavata. Mutra is the Pravrutti Mala in the body. So Mala Nirmana starts in the Pakvashaya. Ama and Chitta Vibhajana, Sara Chitta Vibhajana takes place by Samanavata. Annam Dusnati Pachati Vivecheti Sarakitten Munchati. Apana Bhuta is dominant in Mutra Dosha. Mutra Dosha requires urobilinogen support from metabolism in the liver. So Yakrut and Vrukka are connected. Mutra requires afferent artery supply from the cardiac cycle. So Hrudaya and Vrukka are connected, and Mutra Nirmana is basically Ap Mahabhuta, Tejo Mahabhuta karmas, and Mutra Kshaya are of two types. Basically in clinical practice, oliguria and anuria are two clinical conditions. If the Mutra Pramana is less than 600 ml per day, in 24 hours, then it is called oliguria. Less than 50 ml is called anuria. And Mutra Kshaya is Dravyataha, Gunataha, Karmataha Kshaya. So, basically, Mutra Kshaya is due to Vrukka Shota. Acute or chronic nephritis is responsible for Mutra Kshaya. So, if you check the 24 hours urinary protein, in case of chronic kidney disease or diabetic kidney disease, today we had one patient admitted in Government Ayurveda Hospital, Bengaluru with 24 hours urinary protein problem. He is a case of diabetes, hypertension. Creatinine is increasing gradually from 1.9 to 2.1, 2.1 to 2.2, 2.3, 3.4. He is a regular patient from Raichur district to nephrology unit of Victoria Hospital. So that's why I thought of taking this concept of Mutra Kshaya. Pakvashaya Mutra Nirmana should be normal. Pakvashaya is Vatasthana. Mutra Nirmana is Kapha Dosha, Apmahabhuta metabolism. Apmahabhutagni, Kaphagni, Vatagni, Apanagni, they are all going to be responsible factors. Even the Sadhaka Pitta, Avalambaka Kapha, Kledaka Kapha are also participating in manufacturing of Samyak Mutra. If you do Mutra Pradeshe, Mutrava Srotas Pradeshe Snehana Svedana, the Mutra Nirmana Prakriya improves. So, Katis Abhyanga, Udara Abhyanga, Nabi Basti, Nabi Abhyanga, Katti Dhara, these are all different Snehana Svedana karmas can be used. Murchita Tilataila can be taken for Sthanika Abhyanga in Kati and Udara Pradesha, suprapubic and renal angle area, or Tunga Drumadi Tailam. Tunga Drumadi Taila is Pitta Shamaka, Kafagni Vardaka, and Vatanulomaka. From Sastra Yogam, Tunga Drumadi Tailam can be taken. And this can be used as treatment for Abhyanga. And if you suspect kapha is obstructing the Mutra Nirmana, Mutra Pravritti, Mutra Nishkasana, kapha Meda, if they are doing obstruction to Apanavata, then Hingu Triguna Taila should be used for Sthanika Abhyanga and then Svedana. In case of Svedana, you can use Sankara Sveda, Prastara Sveda, Nadi Sveda, or Pinda Sveda can be used. And even if you think Mutra kshaya is there, along with that, if Kleda is more, then Mutra se Kleda Vahanam. You should use Ruksha Pinda Svedam, Churna Pinda Svedam, Sankara Pinda Svedam. Shashtikashali should be used in Niramavastha. Churna Pinda Sveda should be used in Samavastha. Vedana is going to remove the Kleda from Mutra Srutas. And Vrukka Pradeshe Snehana Svedanam. Next comes is Avagaha Svedam. This Avagaha Svedana for Mutra Kshaya patient, actually, if you do Avagaha Sveda for Mutra Kshaya patients for 2 hours, sitting in a tub bath for 2 hours, where temperature of the fluid is maintained for 41 to 42 degrees centigrade, if patient tolerates 2 hours of hot Avagaha Svedam, then Mutra Nirmana, Mutra Nishkasana, Mutra Vasruto Avarodha will come down. Mutra Nirmana takes place. Next, in Sadhya Mutra Janana Pravartana Pitta Shamaka Apmahabhuta Vardaka Kalpa is Narikela Jalam, Narikela Lavanam, and we can use Tulipanchamula Phantom, Palasha Pushpa Phantom. Now we are trying this. It is a good season to collect the Palasha Pushpa. Palasha Pushpa is very good Phanta. Palasha Pushpa Phanta or Trunapanchamula Phanta can be given to a patient where you want to increase the Mutra Utpatti. You want to increase the production of the urine. And another option is Dadima Panakam, Nimbu Panakam, Madhifala Rasayanam, and with these food and health supplements, you can also improve Mutra Nirmana, Mutra Pravritti, and Mutra Kshaya condition. Gomutra Prayogam, Gomutra Shilajito Prayogam, Karpura Shilajito Prayogam. Gomutra Prayoga is Vriddhi Samane Sarvesham. Whenever patient is having Mutra Kshaya, Gomutra should be given. And parallelly, Swamutra Prayoga is also, Shivambu Prayoga is also one of the thinking of some practitioners. But we give Gomutra Arkam or Gomutra Ghanavati or we give Gomutra Ksharam. These are also going to increase the production of the urine in Mutra Kshaya or the Mutra Pravritti also. Shilajitu, in that actually Swarana Shilajitu or Hema Shilajitu is best for Mutra Kshaya, and one of the best Shilajitu Kalpa you should remember is Chandra Prabhavati. Chandra Prabhavati contains 3 Ksharam and 3 Lavanam, and it is going to do the Kleda Vahana Karma. Chandra Prabhavati, as per the patient, you can give 2 tablets twice a day or 1 tablet twice a day. And another important Rasakalpa you should remember is one is Chandra Prabhavati. It is a Gukulu Kalpa, so Lekana, Medahara, Kapahara, Vatanulomana, Mutrala. Shuddha Gugulu can be given, Shilajitu Gugulu can be given, and in Chandraprabhavati, Shilajitu and Gugulu both are present, that can be given. And next is important Kalpa along with Chandraprabha is Gokshuradi Gugulu. Chandraprabhavati, Gokshuradi Gugulu, Punarnava Mandura. This is one of the best combination we can practice in Mutra kshaya cases. Chandraprabha, Gokshuradi Gugulu, Punarnava Mandura. And Surya Kshara is a very good Mutrala. In the last discussion also we were talking about Surakshara Kasisa Prayogam, Surya Ksharam or Surakshara Kasisam. Both are good in developing the Mutrala effect. Shali Mula, Ikshu Mula, Punarnava are very good drugs for Mutrala benefits. Shali Mula and Ikshu Mula, Chitraka Mula, Yerenda Mula, these Trinapancha Mula. In the Moola Kalpas, I call them as Moola Kalpas. Moola Kalpa means using Moolas. Number one, Pranapancha Moola is Agra and Mutrala, Dasha Moola is Agra and Mutrala, and Shali Moola, Goduma Moola, Ikshu Moola, Yerenda Moola, Chitraka Moola. They are very good in promoting Mutrala effect in practice. So whoever can collect Ikshu Moola, Ikshu Rasa is also Mutrala, but when Ikshu is not a season where you are not getting Ikshu Rasa fresh product is not available, then Ikshu Moola is also very effective. Shali Tandula, Shali Mandapeya or Shali Moola. Shali Moola is also very good Mutrala, Pitta Shamaka, Daha Shamaka drug. So freely available Ikshu Moola, Shali Moola, Eranda Moola can be used. And when patient is not responding to any drug, there is no option, we should go for dialysis. In dialysis, we should be careful that dialysis on a long run causes Vata Prakopam and Rakta Kshaya Karam. Dialysis is Vata Prakopaka and Rakta Kshaya Karaka. That's why whenever you are sending your patient to dialysis, please take care of giving drugs from Ayurveda sector like Trunapanchamula Kashaya, Palasha Pushpa Phantam, Narikela Udakam, or sugarcane juice can be given. And when patient is unable to do Kleda Vahana karma, Sakleda Mutra is there. Sakleda Mutra, Kleda Yukta Mutra, or Kleda Vahana karma of Mutra is disordered. Then one best prayoga is Surakshara Kasisam. Even raised urea and creatinine can be, whenever Mutra Kshaya patient is having normal urea creatinine, that is one category. When progressively urea and creatinine are rising, it is Atteika Avastha. Dharanamiti Atteike, there you should take emergency treatment. And in emergency medicine, one best practice from Maharashtra, central India, what we have adopted is Vajedi Basti. Vajedi soup. Vajedi soup is the Ajantra, 50 gram Ajantra is taken, and that is boiled with 100 ml water, and a soup is prepared. Soupa Kalpana is prepared with Mudga Yusha or any other Yusha. This Vajedi Antra is mixed and 100 ml given for drinking. If patient requires still emergency, this Vajedi Yusha Kalpana takes some time. It takes 21 days, 25 days to make better improvement in Mutrala, Mutra Janaka and Mutra Pravartaka effect. Trunapancha Mula also requires 24 hours to 48 hours for Mutra Janana, Mutra Pravartana, Mutrala effect. Whereas if you give Vajedi Yusha Basti, then that is very fast acting. Within 24 hours, you are able to see the change. When Mutra Kshaya is there, Ajantra Siddha Yusha Basti, Ajantra Jala Basti, for the present patient where creatinine is 4.4 and urea is 100, presently we are trying Punarnavadi Churna Basti we are trying. Punarnavadi Kashaya plus Trifala, Vidanga, Amalaki, Pippali. Trifala, Vidanga, Pippali Punarnava are added in the Kvata. 200 ml Kvata is taken, and we are adding Punarnava, Trifala, Vidanga Churnas, and Churna Basti is given daily. It is Ayukma Basti. Patient feels better after giving Punarnavadi Basti, Niruha Basti. No Anuvasana is tried, no Vata Prakopa Lakshanas are there, and Vajeti Basti can be given 200 ml of Aja Antra Jala. The boiled water of Aja Antra is 200 ml taken, and it is mixed with Punarnavadi Kashaya and given is one pattern. It can be mixed with Punarnava, Gokshura, and Trifla Churna and can be given in another style. And if patient requires more Brahmana, then what we do is the Ajantra Jala is mixed with Ajakshira or Gokshira, and then that is administered. If patient requires Astimajja Brahmanam Vata Shamanam in Mutra kshaya, then what I practice is this Punarnavadi Kshira Paka mixed with Vajedi Rasa, and then it is administered to the patient. Yoga Kala Karma, out of that Yoga Basti is a better option. We also give Basti in between two dialysis points. If patient is going for dialysis on Monday and Friday, then we give Tuesday, Wednesday, Thursday, 3 days we give the Punarnavadi Basti, Vajedi Basti. Then the prescriptions in Mutra kshaya. Mutra kshaya, you can do very simple prescription in Karnataka is Sogade Berina Sharpat. Sogadi Berina Sharbat is available in the market. You can give 30 to 50 ml of this Sharbat. Punarnavastaka Churna is there. Punarnavastaka Kvata, Punarnavastaka Fanta can be given. And patients rice and khichdi are prepared with Punarnavastaka Chala. Then that is also going to be good. And Amalaki Rasayanam, Amalaki Swarasa Bhavita Amalaki Churna, Amalaki Kashaya Bhavita Amalaki Churna, 6 grams 2 times a day can be given. Gokshura Churna, Gokshura Kshira Paka, Gokshura Kashayam can be given, Gokshura Fanta can be given. Khadira Churnam, Khadira Churna 3 to 6 grams twice a day, Khadira Kashayam, single drug Khadira Kashayam or single drug Manjishta Kashayam or combination of Khadira Manjishta Kashayam. If you give Khadira Manjishta Kashaya, only 2 drugs, patient starts improving in glomerular filtration rate. When eGFR, estimated glomerular filtration rate is less than 90, it is abnormal. In some of the companies, they tell less than 65 is abnormal. So when eGFR is declining, try to give Punarnavastaka Kashayam, Punarnavastaka Arkam, or Amalaki Rasayanam, Trudapantamula Kashayam, Mutra Kashayam, Shweta Parpati, Surakshara Kasisam, Shilajito Rasayanam, Chandraprabhavati, Gokshari Guguru, Punarnava Manduram can be given. Next, Kasturi Haldi, Kasturi Archana. It is also very good drug for removing the cledra from Bowman's capsule, cledra from Mutra Vasrotas, cledra from nephron. Next, Lodra Churna. When there is Lodra Churna available with you, give Lodra Churna Kashayam or Lodra Churna Phantom to the patients of Mutra kshaya. And in Mutra kshaya clinically can be of 3 types. Dehydration induced Mutra kshaya, Mutra Vasrotas obstruction induced Mutra kshaya, or renal insufficiency induced Mutra kshaya. When renal insufficiency is there, home remedy you can try is Methika. The fenugreek seeds can be given, fenugreek seed water can be given, fenugreek kashayam can be given, and fenugreek the sprouts can be given. Punarnava, Shatavari, Ushira. These are very good drugs we can use in the Mutra Vasrutu Sangha, Mutra Vasrutu partial obstruction, Punarnava, Shatavari, Ushira, and Shvetapati. Punarnava, Ushira, Tribrit, Sariva, Shatavari with Godanti Vastam can be used. Trivrit is also having Mutra Janaka Pravartaka Vatanulomana effect that can also be tried. And some of the Aushadhi Kalpas effective in Mutra Kshaya are, along with Punarnavashtaka Kashayam, Sukumara Rasayana can be given. Sukumara Rasayana is also effective in Shotahara and Mutra Janaka Pravartaka effect. Shadanga Paniya can be given with Chandanasavam. Amalki Rasayana can be given with Drakshasavam. And Gokshara Churna can be given with Patrangasavam. Kasturi Haridra can be given with Vasakasavam. And Haridra Churna can be given with Bruhad Varnadi Kada. And Metika can be administered with Dantyaristam. And Trivrit Leha can be given with Amrutadi Gugulu. And Ushirasava can be given with Trifala Gugulu or Trifaladi Gugulu. And Shatavari Gudam can be given with Kavyada Rasam. Shatavari Gridam with Kavyada Rasam is also Mutra Srotas Kleda Nashaka, Mutra Kshaya Nashaka, Mutra Janaka Pravartaka. Or you can also use Mukta Pishti and Mukta Shukti Pishti along with Amrutadi Gugulu. Mukta Shukti Pishti can be prescribed with Mandura Vatakam and Punarnava Manduram, Mandura Vatakam, Shuddha Mandura Vasmam. All three are going to be stimulants of renal filtration rate or glomerular filtration rate. So whenever glomerular filtration rate is less, Mandura Vati, Mandura Vatakam, Mandura Vasmam, Punarnava Manduram can be prescribed. Whenever you are prescribing Trifaladi Aristam from Gadanigraha, Trifaladi Aristam, Rasa Parpati is also one of the better choice for doing Mutra Nirmana Vriddhi, Mutra Nishkasanam, Mutra Janaka Pravrutti effect. Rasa Parpati is having a very amazing result. Even though Parpati Kalpas are given in Atisara, Grahani, Arsha, but Rasa Parpati can be given in cases of Mutra Kshaya. So today, to conclude, we have discussed about the three important issues of Mutra Kshaya. Mutra Kshaya can be treated at the level of Pakvashya. Mutra Kshaya can be treated at the level of Bowman's capsule, nephron, and glomerular filtration. Mutra Kshaya should be understood with oliguria and anuria. Mutra Kshaya should be clinically worked out with dehydration-induced Mutra Kshaya. Apmaha Mutra should be directly used. Phanta Kalpana, Drava Kalpana, Dravadravya Kalpanas can be given. If it is Mutra Sroto, obstruction and Avarodha Sangha, then Kapameda Hara, Sroto, Rodha Haram, Avaranagam Chikitsa should be given. Like Sukumara Rasayanam and Bruhat Varnadi Kashayam, Rasa Parpati are effective there. When renal insufficiency is there, Shweta Parpati, Vajraksharam, Surakshara Kasisam can be given. If Mutra, say Kleda Vahana Karma, if you want to increase, Suryakshara is effective, or you can also use Vajevi Basti. The Aja Antara Siddha Jala should be used for Basti, Pana, Yushakalpanas. And Agraushadhi you can prescribe in your general ward or OPD and IPD is Punarnava Mandura, Chandraprabhavati and Gokshara Gokul. In liquids, Draksharistam, Punarnavadi Aristam, Punarnavasavam, Punarnavashtaka Kvatachunam, Punarnavashtaka Arkam. If you get very simple drug like Shadanga Paniyam, what is told in Jvara Chikitsa, Shadanga Paniyam, and one more in Unani drug, they use Kasni as an important drug for Mutra Kshaya. In Mutra Kshaya, Gomutra Kalpas, Gomutra Haritaki Rasayana, Gomutra Vati, Gomutra Kshara, Gomutra Mandura, Gomutra Siddha Kalpas are also to be remembered in your general practice or PG and UG internists OPD level or IPD level practice. Mutra Kshaya is an important concept. You demarcate emergency and general condition. Emergency is EGFR less than 50. It is emergency. Dialysis is modern technological advancement in Mutra Kshaya. And if patient is unfit for dialysis monetary problems are there, financial issues are there, Ayurveda alone also can strongly give results in Mutra kshaya. With this, today let us conclude our Anupurvi discussion number 16. Probably tomorrow I am in one of the conferences, so I will not be taking. And on Thursday again we can join for Anupurvi 2026 number 17. Thank you. If there are any questions, we can take.
Sir, when to decide to just stay with medical treatment and send to emergency management, sir? What is that standard?